general reason why fathers are important in anything to do with children's well-being is, of course, that we have research evidence to say that they matter for longer-term outcomes for children. This can happen in any direction. A positive influence from a father can lead to better child outcomes, and it's also true that a negative influence from a father earlier on in life can lead to more negative outcomes for children later on and in adulthood.
I think what was crucial was when we did the audits, we had sign up from managers and multi-agency practitioners. And I think what came across was how disappointed we were with how bad practice was in Conwy. We gave the initial audit findings back to the social work practitioners. So every team was made aware of this is where we are in Conwy. These are some of the issues. We're not able to evidence our attempts to engage with father or with significant males within the household. We were not able to evidence on our case records that we'd made any attempts at that initial stage.
For me, I work with looked after children, and the difference I think with file auditing, making sure that fathers, right across the board, their contact details, everything is on file. For life story work, it's bringing dads in with the life story work as well. So that's an area we'd be looking at definitely.
I think following the audit, what I got a sense of was within the teams themselves, even before they went on the training, was that we were actually starting to discuss issues around the father. That we'd actually started to, even within the sort of the initial intake and assessment team, that they were actually doing what had taken place in Islington, was that they were actually screening referrals. So they were asking for details from other agencies to say, well, actually, you've sent in this referral. It doesn't contain any details regarding the father or the significant male figure within the household. I then started, as part of my role, I was chairing some of the reviews for children in care. And what I started to pick up on was that actually within the recording I could see evidence of attempts to engage with father. I could see that actually the social worker was not only coming to the meeting to say, I've made these attempts to engage with the father, this has worked or this hasn't worked. It was being discussed as part of the review process.
And I've certainly seen sort of more discussion within legal meetings. I think it's more on the agenda, talking about fathers within agreements, that there's sort of equal look within plans, what services and what fathers being asked to do as well as what mothers. So those conversations, I'm hearing more of those, I think, and that's when you're in a room with service managers and more senior people, that's an important message for social workers, that they're getting that from the top, and it's not something that's just come from within the staff teams. It's being supported by senior management as well.
It was deemed, was no longer deemed acceptable for us not to have had this discussion in conference to say, why wasn't father in attendance? If father wasn't in attendance, have we made attempts to get father's views within the conference process? And so all of this started, I think, to sort of develop some of the sea change within some of the practice in Conwy. Mm-hmm. And I think at that stage, and I was very conscious of the fact that, yes, we've had that one audit, but part of my role is around quality assurance, so I wanted to go back and re-audit the work that we've done. I was not as confident as Mark
I wasn't that confident.
No. I was really surprised when we actually got the data back. I knew we'd see improvements, but I hadn't really taken on board how quick we'd seen some of those, the levels of engagement. I think what I noticed was that when we went back to look at the quality of assessments. I think that was one of the key points, was that actually I was seeing far more focus on assessments, not just in relation to mother, but also in relation to dad's parental capacity.
More specifically, thinking about the process of child protection, there's two very important angles. The first is thinking about risk. We know from analyses of where practice has gone wrong in the case of child deaths, serious case reviews and the like, that it can be very risky not to assess and work with men who have an important role in children's lives, and that's absolutely not just biological fathers, that's any men in a parenting role for children. We know that to not find them and to not work with them can have very disastrous consequences.
Part of the change was also around the social work practice. I think at the same time as the work we did, as I mentioned, we also did, the social workers were doing training around motivational interviewing. So it was all linked together, really, and it came together at a good stage. We've also tried to challenge, I think, some of the myths around parental responsibility. I think that's one of the key areas, really, that a lot of social workers get very hung up on the issue, has the father got parental responsibility? And sometimes that's used as a barrier for actually, for inviting the father to that meeting. A number of recommendations were made in relation to changing our procedures and also our audit tools. So we now do monthly audits, and they are on different themed topics. But at the start of each audit, we ask the question, are the family members' details correctly recorded? But we then make a more explicit question, is father's details correctly recorded, stroke significant male figures? So every audit we do is continually asking that question around, have we correctly got the father's details? Throughout the audit tools, we do ask that separate question around, are we effectively engaging with the father?
And I think we've sort of mapped the engagement of fathers throughout that process, and we are seeing fathers coming to conferences, fathers being engaged within the assessment. When we're going through to PLO and through care proceedings, we are seeing that actually fathers are being included, and actually quite often children are going on to have and develop further relationships with fathers and sometimes being placed with them, which actually is very different from what we were seeing several years ago.
When we did the audit, the most recent audit of 21 cases, what we found certainly in 4 of the cases, and we highlighted case examples, is that the father has now become the main carer in the cases. Previously, we had been looking at, if it was not mother, we'd gone to mother's parents. But actually what we have now got, the scenarios that's now sort of changed, so to speak, is that actually in these 4 cases, because we've actually undertaken assessments and we'd actually focused our assessments on the parental capacity of dad, and we'd actually tried, I think, tried to break down the barriers and tried to engage effectively with dad, what we found is that actually now dad is the main carer of the children. Now, in terms of for the local authority, the outcomes and for the child are positive, because the alternatives would be, if that had not worked out with dad, then we would have been looking at that child becoming a looked after child and coming into local authority care. So that was, in terms of, I think in the most recent audits, that was something that was most striking for me, was to see that actually we had gone, as part of the assessment process, we had looked at, could the dad actually become the carer for these children?
And so what you've got is, you're saying you're identifying improved outcomes for the child, who's staying with their parent, and for the local authority through obvious kind of financial cost savings.